We're going to look at some of the impact right now going on with health in this country. The United States has hit a 33-year high in measles. Now, health experts are pointing to vaccine hesitancy as a large part of the reason for that. And it comes as the American Academy of Pediatrics and other medical groups have filed a lawsuit against Health Secretary Robert F. Kennedy Jr. over changes to COVID-19 vaccination recommendations. We want to welcome back in familiar face to this program. Dr. Jeffery Gold is the president of the University of Nebraska Medical System, kind enough to join us again this morning. Dr. Gold, good to see you. I want to start with measles. This seems like something that this country had its handles on. Why have those handles seem to have broken off?
You know, Tom, as you said in the introduction, we really declared the end of measles around the year 2000. We've had just a handful of cases for almost every year. And now we're almost at 1,300 cases when we're only halfway through the year. A lot of that has to do with, I believe, vaccine hesitancy, which has been an increasing problem and accelerated since the pandemic. And it really has to do, frankly, with the relationship between parents and their providers, their healthcare professionals, who need to have important scientifically based conversations as to the best care of their kiddos. You know, I certainly made that decision for my children, and my children made that decision for their children. To get them vaccinated with a very safe and very effective vaccine.
There's vaccine hesitancy and there's vaccine denialism, though. Has one overtaken the other right now?
You know, there have always been questions about the safety and efficacy of vaccines, and what makes vaccines somewhat different is that you're not treating a disease. You know, when you come into an emergency room, heaven forbid, or somebody does with chest pain or loss of vision or belly pain, I mean, there's a lot of science that goes into that, and you're treating a real problem. With vaccines, you're really preventing them. It's almost like screening for cancer. And therefore, the complication rates of the vaccines and the efficacy have to be really high. Measles vaccines is 97% effective. The MMR vaccines, which are typically administered at 1 and 4 years in 2 doses. It's one of the most effective and safest vaccines that we have.
Dr. Gold, in recent months, the Trump administration has, in effect, cut back on some of the funding that goes to federal governments to universities around the country. You are the president of the University of Nebraska Medical System. So I have to ask you, is there a long-term effect on the medications that we take as Americans if these universities, like yours, aren't able to test them as effectively as you did with this funding in place?
There is no question, Tom, that will be a long-term effect of any reduction of funding of biomedical research. I mean, right now, the statistics are that approximately a half of all of the pharmaceuticals, for instance, prescribed in the United States are developed at American universities. Almost 90% that are used in this country are tested at American universities in large academic medical centers such as ours. You know, I can recall all too well, you know, when the dinosaurs roamed the earth when I was in medical school, 95% of all childhood cancer was fatal, and now it's less than 5%. Why is that? Because of research of new medications and treatments developed in the United States, and actually a lot of it right here in our own university system in Nebraska.
All right, there's a lot of ground we just covered there. Dr. Jeffery Gold, we thank you for joining us once again, sir. He is the president of the University of Nebraska Medical System, and we will have you back real soon because I'm sure we got a lot more to talk about as the summer rolls around.